Or are we recording? Okay, I'd like to call to order the Public Safety Committee of the Tompkins County Legislature for April 21st, 2022. Welcome, everybody. And first order of business is public comment, and I understand we have a speaker, and I would invite him to come forward.
Good afternoon. Robert Lynch, 175 Gray Road, Town of Enfield. I'm here as a council person on the Enfield Town Board. I just wanted to give you an update since emergency response is an area that this Public Safety Committee covers, that on the 13th of April, as I had hoped and expected, the Enfield Town Board adopted a resolution which you should have been forwarded, which requests that the Tompkins County Legislature in turn request New York State through its legislature and governor to enact a limited property assessment reduction for volunteer firefighters and EMS personnel. I don't know if it's going to come up today. It's not on the agenda. I'm not necessarily asking it will be on the agenda, but I wanted to let you know that I'm here to answer any questions should they come up, and that the Enfield Town Board unanimously is fully in support of having this exemption requested and then adopted by the state of New York. Thank you.
Okay. And so, Kathy, you said there isn't anybody else there in chambers to speak?
No, Rich, there is not.
Okay. And typically we don't respond to public comment, but I just would want to advise Mr. Lynch that the Government Operations Committee, I believe, is going to consider this issue at their next meeting. And at future Public Safety Committee meetings, if there was a willingness to have some discussion about other ways that we the county, might be able to assist fire departments and companies to encourage people to volunteer, I would welcome that conversation. So just maybe that's appropriate for Tompkins County Council of Governments, but we could also have that discussion here as well. So thank you.
The Tompkins County Council of Governments will meet 1 week from this afternoon, and I may bring that up for discussion because I'm a member of TCOG. And I will be attending the Government Operations Committee meeting when this matter will be raised. Thank you.
Thank you. Okay. Are there any changes to the agenda? I think we're going to reorder things a little bit. I know the Department of Emergency Response has some conflicts, so we're going to push them to the front of the meeting or earlier in the meeting. But are there any other changes that we're aware of? Okay, Brittany, we good? Right. We have minutes from March 17th, 2022. Could I get a motion to approve the minutes? Henry moves.
I'll move them. Second them.
Mike seconds. Thank you. Okay. Any questions or comments on the minutes? Right. I will call the roll. Henry?
Yes.
Travis?
Yes.
Veronica?
Yes.
Mike?
Yes.
And the chair votes yes. So we have approved the minutes. Moving on to the chair's report. I would like to get a report from Lance Salisbury on the updates to the New York State budget, but we have a guest with us today. Where is AJ Kirshner? And she was hoping to talk to us about overdose deaths. And I would very much like to hear what she has to say, and we'd like to give her a little bit of time to address the committee. So I would give you the floor.
Okay, great. Thank you for allowing me to speak today. I think Shauna Black may have been responsible for connecting me to this group and some things that I wanted to share with all of you. Here today to talk about the fentanyl crisis that is probably the #1 crisis in our nation, and no community is exempt from being affected by it. This committee may know that more than 2 million fentanyl-laced pills were seized by officials in the last quarter of 2021 by the DEA. This is our largest threat in overdosing is laced pills. And one of the biggest challenges with laced pills is that you aren't able to distinguish them, the counterfeit from the authentic pills. But we're seeing this, and we're seeing the mass casualties that are happening in many cities as well. The DEA did try to launch a campaign at the end of 2021, One Pill Can Kill campaign. I think it has some traction to it in terms of its conciseness. I haven't seen it in our community, but I've seen it being rolled out in some other ones, and I'd urge this committee to take a look at that campaign and see if we don't want to put a stronger voice behind it. The new crisis that we are fighting with fentanyl is for people who never intended to ingest an opioid to begin with. And that actually happened to my son July 1st of last year, 2021. My son is Jared Brooks. He should still be with us today, working in our community, drinking a gimme coffee, enjoying our gorges and all that Ithaca has to offer. I started really waking up to this issue of the fentanyl crisis with the loss of my son, because in trying to explore what happened to Jared, there were so many things that seemed to have gone wrong. One of the things that seemed to have gone wrong is the day that Jared overdosed, there was also 5 additional overdoses in Ithaca. This committee actually talked about the increase and spike in overdoses at that time last year at July 2021 public safety meeting. Yet we failed to issue any community correspondence or any alert that we had tainted drugs in the community. Most recently, I did see that we did post a public alert, but that was brought to my attention. Someone was like, hey, look, this came out from the Ithaca Police Department. And then it managed to make its way up to Cornell, and someone from Cornell brought it to my attention and said, look, Cornell got this, police thing. One of the things I would urge that we spend some time with at a future meeting is the communication strategy around fentanyl and laced drugs in our community. Even that last correspondence that went out, maybe a month ago, we didn't tell people what to do. We didn't tell people where to go for fentanyl testing strips. We didn't tell people where to go get their Narcan. We basically put it out there, but we didn't get it out there to every place. Even drug agencies, our substance abuse agencies, were not aware of that notice. So I was really happy to see that a notice could be found, but there was too much work in having to find it for it to be effective communication strategy for the community. I think most people on this call know that teens make up the fastest growing age cohort for overdose deaths in America, and that's directly related to fentanyl. And this is because a tiny bit goes a long way. It's cheap, it's profitable, easy to transport. And I think one of the more frightening things is that the demand among opiate users is increasing the fentanyl supply as well. So we have fentanyl getting into drugs that people don't intend, don't want, aren't expecting. And then we have people who are actually really wanting more fentanyl as part of their drug use. When I speak with the substance abuse agencies locally, not only are they seeing very much increased fentanyl in screens, they're also seeing it among people who don't want it and didn't even know they had it in their system as well. So this is really becoming problematic and becoming just an unknown, deadly kind of force in our community. Today, I was happy to see that the Biden administration put out some new information around drug and alcohol prevention and a new strategy around this particular issue. 4 new policies to combat overdose deaths, harm reduction, increased treatment, better data collection, and sanctions against traffickers. And we've got a lot of work to do on kind of all of those things. So locally, here's what I can share with you locally. Our numbers are increasing, and this is my access to the data that's available. And I would love to hear if there's any other data points that I can be turning to have a better handle on this issue, because our data lags quite a bit. If I just compared a COVID timeline with a fentanyl timeline for Tompkins County from 3/14/20 to 9/30/21, we had 37 COVID deaths and 31 overdose deaths. If you look at the resources we put toward these two issues, I don't think I have to say much more about that. We also know that COVID deaths are likely to be overreported, and we know that overdose deaths are likely to be underreported. So if you took the actuality of those two issues, you're probably going to see those numbers flipped. So again, I just put that out there for everything we've done under the COVID crisis and pandemic, and everything we haven't done on the fentanyl crisis and the increase, the availability for teens to get their hands on these drugs through social media in a second is extremely scary. Admissions to treatment, 262 admissions to treatment in 2020 compared to 569 admissions to treatment for the first 3 quarters of 2021. There's also a growing trend of opioids beyond heroin again. So in fact, overdose deaths in 2021, we had 14 as of September 2021. I don't have data past that. Interestingly enough, we had no heroin overdoses reported in our database in 2021. So it is clear that fentanyl is quickly replacing heroin as the killer drug in our community. I'm here to say also for ER, Narcan reports. 146 reports of Narcan saving people's lives in 2020 versus 201 reports in 2021. And I don't believe that self-reporting and self-helping with Narcan is involved in any of those numbers as well. So I'm kind of here to get the attention of everyone on this committee to say that inaction is absolutely unacceptable around this issue. The fact that I live with this tragedy every day, that was unnecessary and I don't know, preventable maybe. It's a very hard reality, and I'm trying to save other families from repeating it. I believe we need a few things around the fentanyl issue locally. I think the first is more accurate and timely data. When my son died of fentanyl poisoning, a lot of things were mishandled. His police report was mishandled. He wasn't characterized as an overdose death. The police or the EMS that responded to the scene did not take a sample of the powder found at the scene. I don't know why these things happened, and I'm not here to pass any blame on anyone. I'm here for us to learn and to look and to handle more incidents like this in the future more carefully, and not make some of the same mistakes we made with my son. I think we need increased and coordinated awareness and communication. I don't know who's responsible for public health announcements. I don't know if anyone in this group knows who's responsible for public health announcements. But if we're going to put something out there, it should be broadly spread. It should be communicated, coordinated, and it should have what people need to do, where they can get their testing strips. I've gone to agencies door to door to get Narcan and testing strips. It's not easy. I know one place where you can get testing strips. That's not enough. It's not okay. And people need to have them before they're going to use, not at their moment of use. And these are really cheap strategies. So, you know, in my mind, they should be as available as condoms, especially to young people. Community-wide access to the Narcan and fentanyl testing strips, just much widely distributed. Perhaps some planned and careful strategizing around the opiate settlement money that's going to be coming to Tompkins County. I know we're due to get about $700,000 in the near future. I don't know where that money lands, but I hope it doesn't land in existing broken programs. I hope we can do some new and different things. Maybe if it's even communication or a task force around this issue. We pulled together pretty quickly community dashboards around COVID. I think it would be interesting to pull community dashboards around our overall health in some other areas. What is our mental health waiting list? What is our substance abuse waiting list? How many people are in treatment? You know, again, the data that I look at, I don't trust is even accurate. I think it's underreported. And I know because I had to change the statistics for my son personally. And, you know, that's a lot, that's a whole lot of Narcan based on what we were using, over 200 doses in 2021. And I don't have 2022 data yet, but I know firefighters and I know emergency personnel, and I know hospital workers, and I know that number is going to go up. So I think it's great that that's saving so many lives, but that can't be the only strategy that we employ locally. That's actually, I think, all I know that you are busy people, doing a lot of good work in the community. I wanted to have the opportunity to talk and also to say, how can I help with this issue? I'm all about doing something to make a change around this issue. So please lean on me, or please direct me, or reach out to me, or however that goes, so I can play a role in helping you make this community safer from losing another young person to this tragedy. Does anyone have any questions for me?
Yeah, well, I'd like to start just by saying thank you so much for coming and talking with us. And I am so sorry about you losing your son.
Thank you.
You know, if any good can come out of this, it is you speaking up and really giving us a good push. We have been concerned with this issue for a long time and have worked on this issue from different directions. Certainly our jail, we've spent a lot of time with medically assisted treatment, building systems there. When we have control of people that have addiction issues, to try to help them. The detox facility will be opening this year. CARS has implemented their methadone program 2 years ago now. And, you know, we are working on it, but we're certainly not doing all we can do. And this issue of tainted drugs coming into our community, you know, we were aware of. I don't know that we've done all we could do as a county to help try to improve communication, certainly on that issue. And, you know, we've talked about the data issues, and we struggle in the same way you've suggested, that most of the information we get is lagging. And it's not necessarily actionable when people need it. But I'm very interested in what you were saying about the testing strips and making them far more accessible. But I'll turn it over. Travis, I see your hand up. Go ahead.
AJ, thank you for sharing today. You know, as a parent, as somebody who's worked with thousands of young people in this community, I tremendously appreciate your courage and your willingness to help figure this out, and actually to demand something be done differently, right? I think more people need to actually demand that we start doing things differently. In the chat, I sent you my email because there's a few programs and initiatives that I'm involved in, and I would love to connect with you to talk about some of those and see if there's any way we could connect on those. You know, I'm heavily involved in social media because of my day job, and it's amazing to me how many people are openly selling fentanyl on social media, both on Instagram and Facebook, like they're selling sneakers, right? Like, this is something that's a federal offense, and it's just as blatant as if somebody selling a pair of sneakers they got that just released. It's amazing to me how it's out there. I know a few months ago there was, probably longer than that, there was fentanyl that looked like acid hits. And I remember seeing something, but I don't see a lot of stuff about the fentanyl. I hear about it with my job with the city. There's certain information that I get, but I don't think it's all public. So you're right, it's a critical issue. So I'm glad you came, and I definitely think it's something that this committee needs to work on. And I hope to connect with you in my other work.
I certainly will connect. I also just want to point out my daughter in the background. Her name is Marley. She's a brand new member to the substance abuse subcommittee locally. So, and also on her way to pursue her master's at Binghamton University, but she'll be an added voice in a different kind of way behind this issue as well moving forward. So Travis, I'll definitely be following up with you. Thank you.
All right. Is there anybody else? Veronica, I can't see your hand. Are you raising your? I see. Yes. Veronica.
Well, first, what would be the best way for me to raise my hand in this odd situation?
Um, Well, my old tired eyes, you're really tiny. Yeah. Oh, that's getting better. Okay. Yeah, wave your arms.
Okay, great.
But
I'll
do it in
do
a very dignified way, of course.
Yeah. Well, who's going to see me clearly? Like 2 people. Anyhow, yeah, echoing thanks again, AJ, for coming and sharing your story. I'm sorry, this is the first time I'm saying this because I was there at the Mental Health Services Board like a month and a half ago when you and Marley both came. And that was really, I mean, honestly, really generous of you, I think. I believe that's recorded if people want to, for others, if people want to go hear more from them. They really took the time to lay out the story personally. I wanted to say, I totally agree. We should be doing like more about this. And this is really changing my thinking about fentanyl as a public, like, and fentanyl, like overdose and accident, like in all ways as a public health crisis. And when thinking about how freely we make available, like you said, condoms or like masks or COVID tests, like, can we do that with Narcan and fentanyl test strips? I know you got to be trained to use Narcan, but someone trained a whole room of us in 1 minute at the New York State Association of Counties conference and said that counted. So I don't know, that was pretty easy. I think also, I guess I probably want to report back from this like workshop at the New York State Association of Counties that I went to was on, I could write this up more somewhere else, but about opiate management strategies. And they're starting, I think it hasn't launched yet, a like opioid solutions resource center to try to connect counties across the country in collaborating on what can be done at this. I think that could be useful. But we also heard from some other places that are doing like, have way, way better public info about both like the dangers of opiates, the dangers of like the prevalence of fentanyl in the system or in the community, and also like how to get, how to protect yourself. Like you said, like where can you get Narcan? Like what even is it? What it's good for? Where can you get fentanyl strips? Like that you should use them. And they said they were doing ad campaigns like on bus benches and on pizza boxes and like giving out Narcan at the entrance to a public festival and like with these little like overdose prevention bags that there's lots of kind of things that we could definitely ramp up. And I also think one piece, probably not to be done in this meeting, but I'm sure like with you, AJ, and others is connecting the folks who like can send out that kind of public health messaging, but the folks who are really impacted by this crisis or observing or selling, like Travis said, the sale of fentanyl on social media. I didn't know anything about that. I think these might be, correct me if I'm wrong, but like not that well overlapping groups of people. And so like the folks who know and folks who can disseminate the information, yeah, maybe should get together. Maybe we do need a task force. Maybe we should start with, folks who are using fentanyl accidentally or intentionally. And then last thing, maybe this is outside this committee's purview, but I think we should also be thinking about what, like structurally, what turns people to using opiates and street drugs in the first place. Sometimes it's about lack of access to, say, mental health care. Sometimes it's about lack of access to like proper pain management. And then, once you start down some kind of path with unregulated drugs, it can go lots of different ways. And a lot of them are bad.
Thank you, Veronica. Henry.
Yes. Since we have in the room Dominic and Michael and Jeff Dunn, and Sheriff Osborne, I was wondering whether you guys had any comments about the communication process of getting the word out about what could possibly be done.
Thanks, Henry. I'll jump in briefly. AJ, I'm the communications director for Tompkins County. I work with all of our different departments. This is something that hasn't come up enough, to be frank. The health department does keep data on its website and has reported several times at things like this, but there has not been as much active public communication as we've been asked to in different spaces. So, it's something we're having conversations about, and I appreciate the advocacy at this level to encourage us to do more. So that is a charge that I take seriously in my role, and I'll work with the different individuals who are tasked with this across our organization. We have a pretty distributed organization here to have some follow-up conversation on that, and I'll start with figuring out the data on the health department website and what the role that they have to play in some of this is. So thank you. And I'll put my comment or my contact info in the chat for any time. If you have any questions or thoughts or feedback on communications, happy to take that.
Great. Thank you, Dominic. I'll be connecting with you.
Yeah, and I would suggest, I don't know if anybody else had anything to say, but we have a pretty packed agenda and we do need to move along. However, I would like us to put this on our agenda for 6 months to assess how far we've gotten, because it seems very clear there are more things we could focus on and do here, and we should. Veronica, it sounded like you had a whole laundry list of actions we could take, and certainly I think that extends across a lot of our county agencies, and certainly the Health and Human Services Committee would be involved in a lot of that as well. But Brittany, if we could put this, a flag on our agenda for October, 6 months from today, to revisit this issue, to assess where we're at. And certainly we can talk about it in the meantime, but I'd like to give us a deadline to make sure that it's sticking in our heads and we do not let this slide. Sheriff, did you have something? I thought you raised your hand, and I apologize if I cut you off.
No, I did not raise my hand. I would certainly be willing to take part in any public release of information that we decide as a group to put out, and be a part of that for sure.
Thank you. Okay, anybody
Rich,
else? Yeah.
it's Brittany. I just wanted to let you know that I will put a placeholder on the October agenda just so that it doesn't get lost in the shuffle.
Thank you so much.
You're
Okay.
welcome.
Brittany, if you could also remember to invite me back to that meeting, that'd be really helpful too.
Yeah,
Absolutely. I will put that note in there as well.
Thank you.
And you're
welcome.
always welcome in the meantime.
Thank you.
But so thank you. And as I said, I'd like to spend more time on this, but we are pretty pushed, and I don't want to lose the Department of Emergency Response. If I can move their report to this point in our agenda. I know we want to hear from Jeff on the new emergency communication system, which is kind of timely since we were just talking about communication. And Michael, I don't know how you wanted to order your report, but you have the floor.
I didn't have anything additional to what's already in the Tomstat report, so I'd just like to yield this time to Jeff so he can give us all an overview on Siren. And thank you for your consideration, Rich, and moving this up on the agenda, and also just a thank you for your support these last couple of weeks and helping us get some things accomplished.
Oh, you're welcome. Welcome. Hey, Jeff, welcome to the meeting.
All right, thank you. Thank you, Rich. Thank you, Mike, and good afternoon, everybody. Glad to see you all again, although virtually. I think the last time I was in chambers with you, but I know that time will be coming at some point, I know. So I just wanted to give, and I'll try to be brief, just want to give a brief report on our transition from a one mass notification system to another. And on March 25th, we began moving folks and signing up residents to a new system called Siren. We had for many years, since 2017, been using SwiftReach, which we branded as Swift 911. And the short end of it is that Rave, the company that owns SwiftReach, is Rave Mobile Safety, and they are in the process of basically transitioning many of the SwiftReach customers to their Rave Alert platform. So we saw that as an opportunity to, before we're forced to do it, to actually take that leap now. And so on March 25th, we made the announcement, and we encouraged folks to sign up through online or through a text. And we saw this as an opportunity to rebrand this product. Swift 911 really wasn't a way to brand it locally. And one of the advantages to going to this RAVE system is that it does give us the ability to brand locally. I wasn't thinking too far out the box, so I thought Tompkins Alert was a pretty good idea. But our esteemed communications director stepped in and said, Jeff, let's rethink this and come up with something that is more reflective of, perhaps more reflective of our community and easier to remember. So Dominic, if you don't mind, I'm going to share, if I'm able to share my screen, I think I can. I'm going to show everybody here. So this is our logo. And Dom, if you don't mind, just giving a little briefly say what what your thought process was in developing this brand.
Yep. Thanks, Jeff. I appreciate it. And I appreciate the opportunity to work on this with Doer. I'll keep this really brief. The impetus behind this is really that when we have a mass notification system, we should do what we can to have as many people signed up in the community as possible. Rough numbers from Swift 911 were that we could text somewhere under 5,000 people. We could email somewhere under 10,000 people, and then we could call the 50,000-ish landlines. In an event of an emergency, many different emergencies that we've experienced, that has not, that's not a ton of people relative to the size of the emergency. So that's the reason we decided to come up with an engaging brand. And you can see here another example that Jeff's pulling up of some posters, and I'm going to put one in the chat as well of our, I sent that, I'll send it to everyone in a moment. Siren is an acronym you can see there: safety, incident, real-time emergency notifications. And it also references the Greek sirens in the Odyssey. I thought of something sort of connected to Ithaca, and that people really like that connection. So it's engaging. So that's really where it came from. And we've been creating posters, social media graphics, business cards that we're about to distribute widely throughout the community. And I'll put in the chat some social media graphics that any legislator or department head, community member can share as well. And all of this will be available on the website as well as our FAQ. So that's sort of where it came from. And we're just hoping to get our signups really increased by many thousand people.
And we should mention that, we've been in this soft launch period, and now with all of that material that Dominic just was alluding to, we're really going to take now the next step in getting folks signed up. As of this morning, I did a check, and we are in the 9,000 neighborhood of signups, which is pretty good considering we've been at it for just under 4 weeks. And by comparison, if you look at what we had in our Swift Reach account, we had about 53,000. So we had about half of the population of the county was in there. So we're off to a very good start. I wanted to show, let's see, I'm sorry, I need to. I'm going to show you now quickly here. The process is very easy. All right. So here is your sign up page. We have our Siren has its own site on on the Tompkins County website. All right. You're going to come here and you'll click and sign up. Sorry, just got to do it right here. You put in all your information in here. Okay. You'll register. You'll select your preferences to how you want to receive information. And then once you do that, and I don't have any problem showing you what I've done. So this is my profile. Okay. And everybody who signs up is automatically alerted to any countywide emergency alerts. But you are also eligible for all of these here on the right-hand side that you can opt into. So I live in the village of Dryden, so I've opted into the Dryden town and village announcements. There's a checkbox on the left-hand side, and then on the right-hand side, you then choose your preferences. Do you want to receive it as a text, a voice, or an email. And then up here is my preferences to how I want to receive them, by email and by, it gives you the information of what you've put in there. So that, and that's really all it is in terms of signing up. And we will be out with that material. I'm going to be sending out a notice to all our county departments to make sure that our workforce is knows of the change. I know there's some posters that have already been hung in some of the buildings. And then we've got a slew of community events that'll be going on, as we head into the spring and summer months, and a great opportunity to distribute some of the material that we've produced.
Thank
so
you.
with that, I'll entertain any questions, and if we need more time at another venue and another junction, or I'm happy to come back.
Yeah, I have a question to start, which is, would it be possible for you to give that short presentation at our next legislature meeting? Would that be appropriate, do you think? Lisa, do you think that would be all right?
Absolutely, sure.
Sure.
I think that'd be a great thing to get out to as many people through that venue as possible. Yeah, this looks really good. Any questions or comments for Jeff? Veronica.
Thanks, Rich. Thanks, Jeff. I thought I saw somewhere that folks who were signed up for the old system would be like automatically moved into the new system. So how does that intersect with your 53,000, 9,000 numbers?
Right. So we've had a sort of an internal discussion on that. That wording is confusing, and we were using the best practices as provided by RAVE to do that. So anybody who was in SWIFT had their information migrated over to Siren. However, there is no telling if that information has been updated at all. You really need, and what we need to encourage folks to do, is to create a new account. They need to create a new profile in Siren. If they don't, whatever material was in SWIFT is what's being used to send out alerts through Siren. And they may no longer be valid. Your phone numbers may have changed, new email address, and therefore you risk not getting the information. So while it's true the accounts were migrated over, they really need to be sort of activated by signing up through the Siren site. Does that make sense?
It does to me. Thank you.
Okay. Any other questions or comments for Jeff? All right. Seeing none, we'll keep moving.
Rich, if I may, just real quick, to round it out. So number one, I just wanted to thank Jeff for the presentation, but I also wanted to publicly recognize Dominic. I mean, he has been an absolutely fantastic partner. I mean, the branding that we came up with Siren, that came from Dominic. And I mean, I think it's really important for the people in this group to know how much effort and how much of a great team player Dominic has been in this process. So thank you, Dominic.
Thanks, Mike.
Thank you, Rich.
And thank you for saying so. Good to hear. Okay. Next, we have Lance Salisbury with us, who has been tracking the New York State budget and some of the impacts on local public safety. And I wanted to give him a chance to talk briefly about some of what's been going on up there. So Lance, welcome.
Thank you. Everyone can get their pillows out because I'm about to put you to sleep. Quickly. No, change. So let me run through the changes because there were a number of changes, and Matt, if I missed something, please chime in and get me, because I'm going to try to run through them all. There was a lot of discussion that went on during the course of the legislation, proposed changes. The actual changes that came about, particularly in bail and discovery, a couple spots, are less than some of the discussions. But let me run through the main changes that occurred. There were some important changes to gun laws, gun charges. I think some of the big ones were on, I mean, for the most part, most weapons charges were already bail eligible. So some of this was fixing loopholes and adjusting some other things. On criminal sale of firearms, there are a couple of felony levels there, and the standards to be charged under that were reduced for a C felony from 5 weapons to 2, for a B felony from 10 to 3 weapons, trying to expand the ability of law enforcement and prosecutors to charge that crime. They also added adjusted, so there's a presumption of possession of 3 or more firearms is a presumption of intent to sell, which is, we've told them that has a potential to be a bit of an issue in upstate New York, because frankly, most hunters or gun owners tend to have 3 or more weapons. It's probably not going to be a problem for us in this county so much, given our sheriff and DA. And I mean, they both have more of a common sense approach, I think, than some other counties on that. In terms of bail and appearance tickets, they made 3 major adjustments in terms of appearance tickets, so that essentially they can bring people into court for arraignment. Those are someone who's and they become bail eligible. Someone who's 18 or older and charged with criminal possession of a weapon on the school grounds, something we don't see a lot of here. A person who's 18 and older and charged with a hate crime also can be brought into court now, bail eligible. And then they've expanded qualifying offenses. They added a new section under that in the criminal procedure law, one of which is, criminal possession of a firearm under the penal law statute. And 2 other sections. One is if someone is charged, has just been charged, and they're released, they're released on recognizance, released to supervision of Dan in his department, or if they've been given an appearance ticket and have yet to be arraigned on that for a felony or a Class A misdemeanor, and they get charged with another felony or Class A misdemeanor, they now become bail eligible. They can be brought into court. In the other section they added is if a person who's been charged with a felony or a misdemeanor, has a pending charge, Class A misdemeanor, that involved harm to an identifiable person, or they get charged with those and they have harm to an identifiable person or property, they can be brought into court, bail eligible. That's been expanded. It's kind of the harm plus harm standard that was adjusted in 2020. They've now clarified that, expanded that to include harm to identifiable person or property, includes theft of property or damage to property. What that means is now that pennant larcenies and like criminal mischiefs become bail eligible, but they limited that by basically saying if the theft is negligible and not in furtherance of other criminal activity, the person must still be ROR'd or RUS'd. And what they're identifying there when we were up the legislature is essentially they're trying to limit crimes of poverty from becoming now bail eligible. That's not a big issue in this county because Matt's already kind of had that approach, I think, to his credit on that. What that impact will mean in terms of our jail populations, we'll probably see some increase in our bail population. You expand eligibility for bail, that means you're going to expand probably the number of people going to jail. We'll see differential impacts because a lot of this will occur at the cap, and our local court judges have different approaches in how they approach these things. So, that'll play out on that, and we're going to try to stay on top of that in terms of application of those issues. I don't think at this point, given the impact here is not going to be as great as the original proposals here, because they've tried to limit it. We'll have to see how that plays out, particularly with the crimes of poverty issue. I know from dealing with the judges, we're going to have differential impacts and battles over that. I know the attorneys were telling we're going to try to stay on top of that, because our position is somebody who shouldn't be in jail. We can seek bail review at the county court level. The other thing they did was they expanded or made more explicit in the statute the criteria judges could look at when determining release status. A lot of this already kind of occurred informally. I mean, judges were looking at this stuff anyway. So they've expanded the criteria. One of the things is, as I read the law, is it doesn't change. There are kind of two silos here. People who are not bail eligible, the crimes are not bail eligible, and the ones who are bail eligible. So even with the expanded criteria, that doesn't move you, if you're charged with a non-qualifying offense, into becoming bail eligible. It just affects your release status. Where it will really have an impact is crimes that are bail eligible. The standard is you're still supposed to start with the least restrictive condition. That's still the law, which is ROR, and build up from there on that. So that'll probably mean again, probably some more people being found bail eligible. One of the battles we always face in the local courts, there's been this historical tendency. It's either release or, with a lot of judges, or bail. And arguing that they kind of jump over that interim option of making Dan's staff overworked, which we approve of. But so a lot of discussion will probably be occurring on that. So when Dan comes back in a year asking for more staff, you can blame the state legislature that we've overworked him and my lawyers. The other thing they did is they clarified in terms of bail, if they're going to set bail, they've really made it clear. The language says the ability of the person to be able to meet bail without causing undue hardship to that person. And also they have to consider their actual ability to obtain a bond if they set that. It's a kind of a more explicit definition of what the intent of the legislature was there, that you have to, in setting bail, have to actually consider a person's ability to post bail. It's that old thing of if you're indigent and have no income, $100 bail can be too steep for you to meet. But if you're, if I'm a millionaire, telling me I have to post $10,000 bail is really kind of meaningless. I can probably do that pretty quickly. So those are kind of the changes on the bail statute. Like I said, we'll probably see a bit of a increase, I would expect, in the bail laws. The other big change that really affects Matt and I more than anyone is discovery. The good news is they've greatly increased funding for discovery for prosecutors, so that there's now supposed to be a total of $80 million provided for discovery compliance. It appears from discussions at the legislature that Tompkins County was probably a bit of an outlier in terms of actually providing staff to district attorneys' offices to meet the discovery requirements. They've clarified some rules on the certificates of compliance, and on the one hand, when the DAs are going in, and this was actually, I think it, as I noted in my email to you, the discovery rules were actually, this section was resolved by the defense community and the DA's community sitting down and kind of working out an agreement. So now if there's a requirement for the DAs, if they want to do supplemental discovery and supplemental certificates, they have to explain kind of why that wasn't done originally. There's also a requirement for the defense now, which I think is actually a good thing, that the defense attorneys are supposed to contact or inform prosecutors as early as they can if they think there's missing discovery on that. And I guess in essence, that puts us on notice, but it also gives them more time. It gives them notice that there's an issue they need to address on that. So there, excuse me, you see there was some attempts to try to make the existing discovery law more effective and trying to meet some needs raised by both sides. It's been less of an issue, frankly, I think for us. We have a few discovery arguments, I think, as you would expect, but given what I'm hearing from other counties compared to this county, we've, I think, which is a credit to everyone, is the focus here has been more on trying to comply with the law and meet the obligations. I think elsewhere there have been efforts to try to avoid compliance as much as possible. So I think that's a credit to people involved. I think both in law enforcement and Matt's side, that they took the approach of, how do we meet this rather than how do I avoid doing this? And on that, in terms of the other issues were RTA. The only thing they really did was they addressed a loophole here in the kind of the statute of limitations, so that now anyone who's under 18, you would fall into RTA, charged with a crime. They have until the age of 20 to charge that crime. There was a problem. It used to be 18, so it was a problem. If I was 17 and committed an offense, I could age out of their ability to charge me before they charged me. So it's designed to kind of close that loophole. Nothing to my knowledge was done on the beds issue. In fact, when I raised that in meetings, I just got a bunch of blank looks. So I just kind of note that because I think I'm not sure the governor was pushing that. A lot of the legislative leaders, if they're aware of that is getting lost, in the background in these other fights, because that wasn't a topic of discussion. I'm putting it out there because I know that's an issue for the county, for upstate counties, but that message seems to get lost up there in Albany in terms of that need. In terms of mental health laws, there are a couple of changes here, and I'll note there's a lot of talk about lawsuits, so we're probably going to see litigation from advocacy groups over some of this stuff. Kendra's law has been extended to 2027 now. That was due to expire this year. That's the mental health law. There was a change there that they've added under Kendra's law, someone who's been someone who was under a court order, and since the expiration of that order, if that person's had substantial increases in symptoms of mental illness, that it seems to interfere or limit one or more major life activities as determined by, in this case, it's Frank Krupka, I guess, or his deputy, but the Director of Community Services, they can come into court. That's the section I think that's probably going to get litigated by advocacy groups over that, that substantially interferes, with life activities issue. But there's also, they moved sections of the mental health law into the criminal procedure law. So that now that they're for mental health assessments now, a person can be brought into court either for a voluntary release and they agree to undertake mental health assessments, or there can be an involuntary hold on a mental health assessments. If there's the standard there is there immediate serious harm to that person or to others. And that'll probably get litigated out what immediate serious harm means. Because people will have different views of that. But that's I try to give you the kind of quick overview of what was enacted there, particularly the bail statutes. Because that probably means Derek's going to have more guests in the coming year. But probably not the high numbers we were originally concerned about. I'll leave it there.
Lance, thank you so much. And just to not touch a nerve, but to advise everybody, 18B rates have not changed within the budget. It's still possible there might be some action on that in the remainder of the term, but Lance has more to say, but as quick as you can, Lance.
I was just going to give you an update and I'll follow up with an email because I can give my full report now and then you're done with me. I'm going to follow up just because you need to be aware of this. There's a lawsuit in the city, but there was an offer made by the executive last night, which fortunately has been rejected. That was to double the rates, no other change to the statute, which would mean the counties would pay for that increase. What that would mean in terms of Tompkins County, we pay about 1.8 million annually in attorney's fees. That means 3.6 million, which would give Jay a heart attack if he heard me say that in terms of what that does to assessments. I'll follow up with an email on that. I thought because there's a 2-week period here down there where they're negotiating, arguing about a preliminary injunction before the judge gives her decision. You should be aware of that. And I'll follow up with more on that. One more thing I think you need to be aware of, if I could just present this, I've talked with Frank about this and he's kind of aware of it. It's kind of, I really feel this is, and I think he agrees, it's a staffing issue for mental health. But we're seeing increasingly both our criminal cases and family court cases, people who are kind of in crisis who are with mental health, when we look at their current level of care, they're getting like telehealth with a mental health counselor every 3 weeks. And it's leading, we have issues of people on VOPs and in family court having their kids taken away. That's not meeting their needs. I think the issue seems to be staffing, mental health's ability to provide services, but it's starting to have blowback on our cases, our clients. I just want to raise that because you're probably, for the members, you're probably going to hear more about this in the coming year, just so you're kind of flag it.
Thank you. Okay. All right. Well, it does sound like we'll hear in our May meeting, maybe something will have happened with the 18B defense rates. But at any rate, thank you very much for that update. Are there any questions for Lance? Okay, Matt, anything you wanted to add? You're good for now?
Yeah, I can't really disagree with anything that Lance said of any significance anyway. So good job, Lance.
Well, you guys never disagree, which is great. Yeah. Okay. Let's move on. Our next item, I was hoping to talk about some information received from Ray Bunce on jail population, and I'd shared that with committee members, but I think let's hold that to our next meeting because I'm afraid we're not going to be able to give it sufficient time, but I really do want us to look at that. And particularly, it sounds like there are some state law changes that are changing what COs, corrections officers, are having to do in terms of care of the inmates that we should be aware of and think about, especially in light of our thinking about programmatic changes at the jail and what kind of space needs that might entail. So I'd push that off to our next meeting if that's okay with everybody. And then instead, I'd like to move on to the county administrator's report. And I know that Lisa and Shelley and Deanna and Mona are with us. And I turn over the floor.
Thank you, Rich. And thank you for acknowledging our partner from the city. Shelley Michelle Nunn is with us. Deanna and Mona Lita Smiley, our CJC coordinator, is going to give us an update on a process overview on one of our recommendations for reimagining public safety, and that is the alternative response for crisis intervention and wraparound services. I believe you all received a handout in advance of the meeting. So I think, please, Mona, take it away, and I think she'll be covering the handout.
Thanks, Lisa. Good afternoon, everyone. I'm going to go ahead and try to share my screen. If everyone can let me know if you can see that. All right, is that visible for everyone?
Looks good.
Yes.
Yep.
All right, so I mean, we start with our charge, goes back to the New York State Executive Order 203, which is centered around communities of color. Our local reimagining plans that were passed by the city and the county in April of 2021, inclusive of plans that to collaboratively reimagine public safety and to create and implement the Community Justice Center. So the plan we're talking about today, like Lisa mentioned, is the alternative response for crisis intervention and wraparound services. So what I'm going to present today is the process overview and plan, and that consists of evaluating existing models and implement an alternative to law enforcement response system for the crisis intervention and wraparound health and human services delivery. The process outcome is to create an integrated model in Tompkins County that will dispatch crisis intervention wraparound services and agencies to health and human service related calls, to create a better and more integrated connection between individuals in need of support services available to them, and to reduce disproportionate minoritized contact and promote equitable service delivery. The framework for this will be the healthcare, mental health care, and human services professionals. It will address calls that could be serviced by a non-uniform staff member, increase resources to non-uniform staff and agencies, which would help preserve law enforcement resources for responses requiring a uniformed officer or responder. We'll better explain 911 dispatch, response types, and what to do in different situations to make a report or engage law enforcement, create a collaboration with all law enforcement agencies operating within the county, and provide oversight to separate from law enforcement agencies. So there's a research component, and that will consist of analyzing downstream health and human services capacity in the community as more individuals are diverted from the justice system to other systems of support. Currently serve public safety and health and human services departments that could act as non-uniform responders, responding agencies, under this model. Evaluate the expansion of our community outreach workers, consider an investment in additional existing county resources or contracted services with outside non-governmental agencies, or possibly both. And then community-based resource hubs, which would be spread throughout the county, geographically targeting marginalized population centers and offering a more accessible, inclusive, and inviting and safe way to access those services and engage with law enforcement and alternative responses. The planning group, which will be tasked with implementing this plan, they will also report progress to elected officials and community members. They'll engage in community. We'll engage the community in all aspects of the process, including outreach to reach the most vulnerable in the community, in addition to the majority of the population, and also the planning group will dissolve upon completion of the assigned plan with content expertise requested as needed So here we have a list of people or entities, groups, organizations that will be included in the planning group. I'm not going to read all those off to you. They're right down the screen for you to see. We have milestones for the success of this, which is to formalize a planning group. So there's just dates listed right underneath there for each step of the process, to review and analyze local mental health data, complete the call delineation for mental health responses, complete a research study, and finalize a report and plan and recommendation to be presented at the end of December. The budget, there's an initial one-time investment that can be used to help identify a plan for implementation. So $25,000 has already been allocated for consultation, travel support, and research materials. So there's a breakdown of those charges right here on the screen. As of yet, we have not, we're still in the process of looking for consultant research and that for it. We have the consultant research fee, travel, air travel, lodging, research materials that are listed there. And so each jurisdiction, meaning the city and the county, would pay, they pay half, so it'll be $12,500 each. What would happen next would be upon approval of the recommendation, which would be in December of this year. The plan would enter the implementation stage, and that includes funding requests, hiring staff, and system updates as appropriate, and then initiate further engagement and other process steps as outlined in the planning phase. Thank you. Any questions?
Thank you, Mona. Any questions? Comments? I noticed that the April 15th date has gone by us. Have you reached that milestone?
I think we have. Well, we haven't formalized yet. We just got the finalization on who we're reaching out to create the planning group. So we had some clarifications that we had to take care of, but we have that list finalized. So that invitation will be going out next week to that group to invite them so we can get formal.
Also, just to add a little bit to that, we wanted to present here and at the city, the common council as well. So we have the information. At the same time, we wanted to make sure that both jurisdictions had the same information, then move ahead. So this was presented to, just in terms of a consultation, the sheriff's office, Department of Emergency Mental Health Department, city stakeholders, ITS from both areas, just a broad group of just internal stakeholders first. So they would be aware, and they had a chance to provide feedback on this process overview in advance. And then those are the dates initially outlined, knowing that we would have to make adjustments based upon our elected leaders' schedule. So we have everything prepared, but stand for any questions, but just wanted you to be aware in terms of that timing. We pushed things back a little bit just to make sure that everybody had the same information at the same time.
Great. Okay. I'm sorry that Department of Emergency Response couldn't be here because they had the conflict, but it seems like they're going to be an integral piece of this, in that it is so important to get the information, and the nature of the call hopefully is aligned with what's actually observed by whoever responds. That I'm interested to see how we develop that piece of it. But yeah, this looks good from my standpoint. Anybody else? Veronica.
Thank you. Thanks for that report. I have a small question and a big question. The small one is, I saw a 988 representative on the list. I do know what that is, but can you say a little bit more about what 988 is going to be? I don't know who exactly I'm asking.
Oh.
Deanna, Melita.
Mona, how would you like to proceed? Go ahead, Mona, what would you like?
You can answer.
Okay.
Right.
Sure. I want to always defer to Mona as our new product director, and I'm here to support her however I can. 988 is the new suicide prevention line that will be going live in July. They will be, again, to use Rich's term, integral to the process, knowing that July date is coming fast and soon. And so we want them to be a part of the alternative response, knowing that I know we use the word alternative, but we recognize that there will be myriad ways in which we will support our community. And so 988 could be one. We also have our unarmed pilot program that we're doing with the Sheriff's Office. We also have the LEAD program as well. We also have our community outreach worker program. And so our goal is to have system improvement that includes all of those different colleagues, but specifically around 988. That will be a number that our colleagues, if you need help, you feel like you're in crisis, or you need support, and not being ashamed to ask for help, that's a number that all of our colleagues will be able to call, or anyone, friends, neighbors will be able to call to ask for assistance. And so our goal, knowing that that's fast approaching as a part of this process, is to make sure that they are wrapped tight into this process and that they are aware as we move ahead.
All right, thank you.
Awesome.
Any
Thank
other
you.
questions or comments?
I have my big question, if I can also.
Yes, please.
It wasn't that. We have been hearing a lot, even in this meeting, about the what seems like a huge mental health crisis in our community, how it's falling into the criminal justice system. Like what Lance shared, it was a lot to absorb, but I heard that you said a lot more people with mental health issues are coming into the court system and sharing that the treatment they're getting is minimal. I know, I guess we're skipping over an email that Captain Bunt sent us about the jail population, but one thing he noted was a lot of people with mental health issues are coming into the jail more so than before. And I feel like what, the pie in the sky thing we need is just like a huge transformational rethinking and increase in our mental health services community to direct people out of the criminal legal system, but that may be way beyond the scope of this. So my question is just what is the scope of what this alternative response and wraparound services could look like? Like how much size changing resources could maybe go into that, if that's known at this moment?
Sure. So if we look at if you look at the framework, that really is the scope, and those are the questions that we will be asking. I'm only saying that because I know those are listed very detailed there in that space. And so looking at our existing structures and what we have, because our goal is to bolster the things that are going well, right? And support those folks. There's been a lot of colleagues, and I think about the community outreach worker program, just as an example, doing really, really great work. But I think it's been unanimous in talking to various people that people would like more of that service. What could that look like? And by the way, I'm not advocating for or against anyone. I'm just speaking to just some feedback I've heard. But then also, we also know that crime will exist, or there are times when people have to be detained, or there's a public safety concern. And so to Rich's, or in our other comments we've had with the sheriff as well, looking at programming what's available in the jail, so what does that look like? And then again, with our LEAD program, our law assistance aversion program, I'm messing up my words today. Those are different ways by which we can funnel people in and out. So in my perspective, while this particular program targets our mental health system specifically, I think it's going to be as dynamic as we allow ourselves to dream. That is the hope and that is the goal. However, we recognize from just talking to other colleagues throughout the country is that they feel like we have tools that we can use to build upon those things. And so we will see where this goes. We believe that the Reimagining public safety process is a living breathing document. So we see where we can get in the next 9 months because our community is calling for action now. And what can you do if this moves along? And then we will say, based upon what we've learned here, this is the next step. And so we'll, to answer your questions, I do believe we can reach for some of those things. It's just a matter of how we situate those in the process. Hopefully that answers your huge question, your big question.
And Veronica, I would add to that we're looking at the programmatic aspects of our current jail and where we want to see that go. And I think there's a term that I can't remember now, Dan, maybe you used it for the mental health facility to crisis response. But we may want to think about that aspect of having a facility that sits perhaps even next to the jail that is a mental health facility for people who are on that borderline involvement with the criminal justice system so that there is a clear alternative for courts to use instead of the jails. But that's, it's next to what this alternative response is, because it's really the initial response. But we do need to think in systematic ways about what comes next, I believe. So Henry, I see your hand up.
Yes, I noticed that in Ray Bunce's email, he talked about the lack of basically being able to hire new people. And I was unsure about whether there was a constriction on that, and whether once the contract is signed, they'd be able to hire new people to add to their system. I also know that mental health has many challenges in terms of hiring new people too. And so I wonder whether you'll address this in the process.
Well, in our sheriff's report, we're going to see that there are some new deputies and corrections officers, which is really good news. But I think we'll hear from the sheriff shortly, and he can tell us about that.
Okay, but Ray Bunce's letter specifically addressed the
Yes.
hiring process.
And
Okay.
I would like to give us a sufficient time to talk about what
Right.
Ray was sharing with us. I'd really like to devote time at our next meeting to it, because I think it's important, and I don't want to go too fast on it.
Okay,
But if that's okay, yeah.
that's fine.
Veronica again, yes.
Real quick, I saw Lance, you put something in the chat, but I can't read it from here. Would you mind saying it out loud? It looked promising.
Sorry, I would just notice when you're discussing about mental health, the increase in issues. I think in the criminal justice family court system, nothing earth-shattering here. The pandemic has really exacerbated mental health issues for people, particularly those who are already suffering, and that's part of the increase in need for services here. Is it's one of the side effects of the pandemic.
Absolutely. Okay, Travis.
I'll make this quick. As we're talking about these new initiatives, as we're talking about these programs, we're talking about stuff related to the jail and folks with mental health. I know the sheriff's department, the city police are dealing with more mental health issues that aren't really necessarily criminal issues. As we get prepared for these changes to our systems, we really have to do some work around our mental health department to make sure that they are robust enough to handle this influx, and that they kind of step into new practices that if other systems are changing, we have to ensure that our mental health system is changing and is ready for it, because the idea would be to keep people out of the criminal justice system, to be working with folks before they get into the system. And either way, our mental health system is not prepared for what we're dealing with now and for what's coming.
Yeah, I agree. We've got some real challenges in this area. Okay, anybody else on this issue? Okay, let's thank you. Do we need to vote on this proposed plan, or is it being implemented, or was that informational?
It was informational at this point, in that this is the operationalization of what in terms of a policy perspective, but we're bringing information back to you based upon what you've already voted on.
Very good. Okay,
Thank
let's
you.
keep going. And next up, I see we have our sheriff. Welcome.
Hi, Rich. Thank you. Just a couple things. Been working with Deanna and Mona to continue our progression towards our sheriff clerk positions. I think I told you at the last meeting that we potentially hired 2 people. We're wrapping up their background investigations now, and hopefully we'll get them on board pretty soon. So I'm excited about that, and I think that'll be a good thing for us. So I'll keep you posted as that moves forward. And I know Deanna and Mona are as well. The only other thing I really had was Ray's email you mentioned. And I guess I won't say anything on it now. if we're going to talk about it next month.
Well,
But
you
that's-
certainly can if you want to add any information to it for us to think about.
Yeah, I mean, just a couple things to think about. You know, I'm sitting here, I'm listening, and, you know, I know there's a concern of keeping people out of the criminal justice system. And I agree with that. I definitely am all for alternatives and things of that nature, but you have to keep in mind too, that sometimes jail is a place to get people straight and get them on a path where we can get them into services. You know, and I know we've talked about this before, that I am fearful that, you know, some of the stuff we do does kind of provide a disconnect where some of these opportunities are missed. And I can give an example. My own sister, drug addict, quite honestly, and that shows that it affects all families. Many, many years ago, she was in our jail here in Tompkins County twice. One of them was my doing. Me and my family were thrilled to have her in the jail for the mere fact that it kept her from using and it kept her alive. If she hadn't been in jail, she'd probably be dead. Tompkins County put her through rehab twice. The first time she was kicked out almost immediately. The second time she succeeded, but went right back to her old ways, and now has charges pending in Cortland County, felonies. So, you know, I kind of have mixed feelings on that, and I think it's just important to keep that part in context. Couple things that came to mind, you know, with Ray's email, and I would have given you my opinion. We have more COs now than we have inmates. Granted, they're not all working at any given time. We spread them across 3 shifts, but the reality is we have more COs now than we have inmates in our jail, which has been something new for the last few years. And there's not really an issue, in my opinion, with, you know, staff in the jail not having time or resources to do the work they need to do, and even take on new job duties when they need to do that because of that fact. Our problem with staffing in the jail goes back to the same things I've been saying all along. It's our building design. It's our antiquated disability time that we have, that we just got rid of on the road patrol, but haven't been able to do it yet on the jail side. And as far as getting good quality people, you know, our contract is important. We have COs that are interacting with inmates that are getting paid McDonald's wages. That's a problem. It helps us, hurts us when it comes to recruitment. I think our civil service list as of yesterday had 2 people left on it. And it's only slightly better for road patrol. So just some things to keep in mind. I know I've been working with Lisa. We're working on the jail contract. I'm hopeful that'll get settled soon. That'll make some differences. You know, and another thing to keep in mind too, and I brought this up to Jason 3 years ago when we first started looking at the jail contract. I went so far as reaching out to the director at TC3 that has 2-year programs in both mental health and in substance abuse. I can't remember the exact names of the programs, but I offered up, boy, that would be a good opportunity to maybe consider, you know, something in the contract for COs that, you know, if they come on board with that certification or that 2-year degree, maybe they get paid a little bit more. Or maybe if we pay them a little bit more, we'll get people that come in with those credentials already. And so that's another thing I think you maybe should keep in the back of your mind. So that's it. So I appreciate you letting me kind of speak off the cuff on that.
All right, well, this is not the end of the discussion. This is the beginning. So that's great. I did have a couple questions and comments on your report, but I'll let Travis go first.
Derek, I think that's a great idea in regards to kind of cross-training COs, where they would have the skill set in mental health and addiction to work with inmates in a different way. We know that it's difficult right now trying to find people to work in those systems, but to have COs who are cross-trained, I think that would be great. We did a program with the Park Foundation and CLAC, where students of color were able to go and get their degree in addiction services, work locally, and have all of that covered, right? To help bring new folks into those systems. You know, there's some things out there that may work to make that happen. I'd love to talk more about that.
Yeah, absolutely. Yeah, no, that's good to know. I didn't know that, Travis.
Okay, Deanna.
I want to share that our colleagues from the Reimagining process met with TC3 this week. they reached out to us in terms of connections and partnership around the work. And the things that you're describing, Derek, align well with the discussion that was held. And so just wanted to follow up with you because there could be partnership around the training recommendation as well. And now you can talk about recruitment and retention. And so I look forward to learning more, and I will reach out as well because they're very eager to collaborate with us on. So thank you.
Awesome. Yeah. Okay.
Okay. I wanted to congratulate you on the hires you've made of deputies and COs. It appears you've had some success in finding new employees. That's great.
Yeah, we are, Rich, and it is exciting and it is a relief. The COs, a lot of them we have to hire them on the front end, and then they have to pass the requisites to keep their job. So that's not ideal. But we're filling the positions. People are interested in them. The outpouring of applications we got on the sheriff clerk was very impressive. Yeah, so it's interesting. It's interesting you get that many applications for a sheriff clerk position, but you get less for like COs and deputies. And I'm not quite sure why that is, but it's definitely interesting to think about.
Well, I had a chance to go and see some of the physical testing that they have to go through and they have to pass in order to keep their job. There's a lot of stress with that. Most jobs you don't have to do that, but you got to run. You got to do sit-ups, push-ups, and it's impressive. The other note I wanted to just mention was the letter from the Village of Groton Police Chief. I think that's a real commendation of cooperation and collaboration with other policing agencies, and I think it makes all of the police agencies stronger when you do that. So I was very happy to see that letter. Yeah. I did have a question about the website. It appears I couldn't find the jail statistics that have been on there, the daily jail statistics. Has there been some change, or was I just doing something wrong?
No, there's no change, and I'm glad you mentioned that. I haven't had a chance to check the results of it, but I was talking to Megan Cook, my executive assistant. Some other things had vanished from our website, and when I talked to her yesterday about that, she had no idea how that happened. She's gone for the day today, but that is something she's looking at. So I'm going to guess that piece of it probably vanished with a couple other things as well.
Okay.
So we are.
Yeah, I think that's a really good transparency report that you provide. So I'd hate to lose it.
Yeah.
Okay. Anything else for our sheriff? Thank you. We'll move on. District Attorney. Welcome, Matt. How are you doing?
Thanks, Rich. I'm well and happy to see everybody virtually. We are continuing to do a lot of trials and have moved some of the older cases out, and those individuals are no longer in our jail. So that's a nice thing to be able to report. We have trials scheduled for the next several months, almost back to back to back. Not every single week, but many trials. So we're moving the system along and using our 3 judges that we have now. I think that this 3-judge system is in full swing finally after COVID interrupted it. So I won't say anything else really, except that I'm not looking specifically to sit in any more meetings and to do that kind of stuff, but I want to participate in the reimagining process and just want to offer myself up there to any subcommittees and groups that might think I have something to say. I'm happy to do it.
Thank you for putting that out there, Matt. That's important. You certainly have a part to play in all this. So yes. Okay, any questions or comments for our district attorney? All right, we're good. Right. We heard from Department of Emergency Response, Department of Probation and Community Justice. And Dan, and I see Carla is here. Welcome. And I had an opening question, Dan. At our last meeting, you did a book recommendation and I didn't write it down, and I have a pen, and I was wondering if you could give that to us again.
I always forget the title of the book. It's
Red.
I think it's Red Jacket, or I will email it to you.
Thanks. Okay.
Sorry about that.
put you on the spot.
No, it's a good book.
Okay, go ahead.
All right. Well, thank you all. We are finalizing our annual report for 2021, which upon completion will be distributed to members of Public Safety Committee. It'll also be available on our website for the public and anyone else who's interested. It's a busy time of year for us. Yesterday, we received our New York State aid plan, which we have to fill out. It's 41 pages this year, and it's due by May 18th. Again, we received it yesterday, so Carla and I will be diligently working on that. And following that, we'll obviously start off with the 2023 budget discussions. Been doing some trainings in the department. Our family court unit and several of our supervisors participated in a recent training on addressing bias in juvenile justice outcomes, which was a good training. Definitely one of our goals is always to be unbiased and have fair, equitable outcomes for all of the people that we deal with. This one was specific to the juvenile population. Want to thank the Sheriff's Office for, on May 5th, we're going to receive our annual required PREA training, the Prison Rape Elimination Act. Everyone in our department who goes to the jail needs to have that training annually, and Ray Bunce has organized that to come speak with us on May 5th to present that training. Wanted to address or further flesh out some more that I learned last week about the new training requirements for probation officers that I alluded to in a prior meeting about it going from 4 weeks to 9. There's some issues with that the Council of Probation Administrators is working on resolving now. There are not enough facilities in New York State to train the officers that need to be trained currently. So the new requirements placed on us by the Municipal Police Training Council are going to include physical fitness, the physical fitness component similar to what was mentioned with the corrections officers, running a mile in a certain time, doing push-ups, sit-ups. The problem is our civil service job description for the last tests did not include any of that information because that information didn't exist at the time. So we currently have a list when we need to hire people who the extra 5 weeks of training, that need to do physical fitness, meet physical fitness standards. They may not be interested in the job, yet we're going to be stuck with the list. So it could have hiring implications for us down the road. And as a state organization, COPA is trying to address some of those things. I'll keep you updated on the outcomes, but we're going to need the civil service job descriptions to be updated for the next test so that people know what they're taking an exam for, and we're getting people who are actually interested and capable of fulfilling what's asked of them in the mandatory training. I wanted to address Lance's point about more RUSs and people being referred to our department, just to alleviate any concerns that you have. We're not, our capacity for more people exists currently without adding additional personnel, so we're in good shape there. The one area that I do see, I'm sorry, I got some feedback. The one area that I do see a lot more utilization than we've had in the past is, are you guys getting feedback?
No.
Okay. A lot more electronic monitoring cases, which, and when we're talking about the 12 to 15 people released under supervision on electronic monitoring, it's working out right now because legislature had the foresight to give us a additional senior position a few years ago, which half of that position is dedicated to electronic monitoring, the other half to our city drug treatment court program. But if that were to expand a lot more, I think it would potentially require additional personnel or maybe a half-time person. But as far as the RUSs go, we're in good shape. I definitely would like to be part of any conversation about mental health and the staffing levels. We're definitely seeing a lot of mental health, serious mental health issues with the folks that we're supervising. There do not seem to be enough resources in the community, which has been, discussed at length here. But there are some things specific to the mental health systems that I would like to speak to. Probably offline would be more appropriate, just to protect the confidentiality of the clients that we're working with. But there's some serious things going on, and it's requiring a lot of additional time out of our officers. They can handle the issues and de-escalate people and get them back on track in most instances. It turns a 15-minute visit into an hour visit. So it's a lot of additional use of their skill sets for an extended period of time. We're happy to do it. We're happy to fill in the blanks, but we really need more mental health staff. And I was on the Human Services Cabinet meeting today. Frank was talking a lot about the difficulty that they're having in hiring people, finding people that want to do that kind of work. So I understand the predicament he's in, but I had participated in the systems of care training about mental health for juveniles. And one of the things I thought about that's an obstacle that hasn't been obstacle to accessing mental health treatment that hasn't been discussed here is oftentimes people are in crisis and they need to see somebody right away, but they don't have insurance. So something that you might want to consider is something similar to like a free clinic where people with emergency needs, my thought on it would be that they could be 1 or 2 county employees that work at the mental health department that don't need to do billable hours, that are just there for emergencies, and anyone can walk in or be referred there and get the mental health treatment that they need without having to worry about how they're going to pay for it. Because that is an obstacle to a lot of people who want help and need help immediately. And they just, if they don't have health insurance, it could be weeks before they get it. And by then they've suffered extensively because they have not been able to access the service. That's all that I have.
Okay. I know you have a resolution. I can put that on the floor, but I wanted to make sure if there's any questions or comments on what you said. Okay. Certainly, it does seem like mental health we're hearing it from so many different directions. And to Lance's comment about the pandemic, I'm wondering if we're seeing the wave coming through as a result of what we've just experienced from the pandemic, and that the mental health issues will wash over us after, and are doing so right now. Don't know, but it's interesting to me that there seems to be such a consistent, attention on that issue, that it's coming
Absolutely.
at directions. At any rate, go ahead.
Anecdotally, there seems to be a lot of truth in it. I also wanted to just speak real briefly. I was touched by AJ's presentation, and I'm going to seek accessibility for fentanyl testing strips to give out to probation clients, or we could give them to anyone if we can find them and make them available. But also, when we're made aware that there's a lot of overdose activity going on in the community, there's a batch of fentanyl going on, we could also arrange to post that on our probation department website, share it, and definitely share it with our clients, as we did last time we were alerted by IPD. So
that would be really good. And I think we have to think very creatively how we respond to that really difficult message that she brought to us. Yeah. In the meantime, I have reappropriation of Park Foundation grant for benefit of the drug courts of Tompkins County, doc ID 10741. And could I get somebody to move that? Travis moves, Veronica seconds. Right. And so this is for a $21,271 grant. So I assume we want the money, but if anybody has any questions or comments, we ready to vote? I'll call on Veronica,
Yes.
Travis,
Yes.
Henry,
Yes.
and I think Mike has stepped out, so I'm going to vote yes, and that passes.
Mike put a yes in the chat.
Oh, he did. Oh, yeah, I don't see him on the screen, but Mike voted yes as well. Thank you. All right, anything else from Probation and Community Justice?
I don't know if Carla has anything to add, but that's all that I have.
All right, Carla? Okay. Hey, thank you for coming. We heard from Lance at the Assigned Counsel program. Is there any other business to come before the Public Safety Committee? Any closing comments? I have a request. Veronica, you seem to have a lot of information you brought back from NISAC. Could we plan on having a conversation in the next week or so on the fentanyl issues? I'd really
Yes.
appreciate that. Thank you.
Yes, happy to.
Okay, anybody else have anything to? All right, thank you very much. We will see you all in a month. All right.